We all know about the dangers of floodwaters to our property. Well, what about to our bodies? Okay, we've got a doctor, Dr. Noreen Kahn-Mayberry. She's a toxicology doctor. Thanks for joining us this afternoon.
Thank you for joining us.
Thank you.
You know, our first concern is we've seen so many people escape in these floodwaters. They had to. They had to walk out in them.
Absolutely.
Also seen a lot of people play in these floodwaters.
Yes.
And I'm just wondering, what are all, I mean, I know what's in that water, but you probably have a really good idea of what is and what it can do to our bodies.
Absolutely. It actually drives me a little bit insane when I see people just playing around in waters or doing the dance challenges in floodwaters, because the floodwater is full of contamination. And I'm talking a lot of different sources of contamination. Chemical contamination, biological contamination from animals, from excrement, from runoff from farms, from, you know, just general viruses and bacteria. And with the weather heating up, I mean, it's really, really growing and proliferating, getting higher and higher in concentration. That's why you see the E. coli levels, which, you know, really, you know, induce really bad diarrhea. They're above safe levels right now in these floodwaters.
Wow. What's the biggest concern also? I mean, there are all sorts of ants out there.
Absolutely. Absolutely. And
snakes.
Exactly.
And we've seen some gators too.
Absolutely. So in terms of the snakes, at least about 85% of them are non-venomous. That's the good news. However, most people don't know how to identify venomous versus non-venomous.
Well, water moccasins seem to be the biggest thing that people are talking about.
Right, exactly. And so if you are bitten by a snake, the first thing that you should do, which is hard for people, is to remain calm. And the reason that is so important is because you don't want any venom to like be spread quickly throughout the body. So the faster you move, the more excited you are, it can get into systemic circulation around your bloodstream. You don't want to panic. You want to stay as calm as possible. If you can, you know, tell what kind of snake bit you, try to look at it. Do not try to capture it. Do not drink any water. Do not eat while you're waiting for first aid. If you can't get to medical attention right away, the best thing to do is wash the area off with alcohol or soap and water, and then wrap it gently, okay? Not a tourniquet. Do not cut off the circulation, but wrap that area gently and make sure that you've got that area secured so that, again, that stops the venom from spreading, and so that's what's so important.
That is really good information. Okay, so we talked about the floodwaters. Now people are going back to their homes that are now kind of sort of drying out. The floodwater is left, or people in a couple weeks will be going back to their homes after the floodwater had sat in their home for weeks and then finally flooded out. I can't imagine the number of toxins. What are some of the dangers that homeowners should know about?
Right, so everything that was in the floodwaters is now on everything in your home. And even though the floodwaters have receded, all of this contamination is proliferating. So anything that is fabric, cloth, furniture, mattresses, clothing, you know, teddy bears, toys, leave that, throw that away, because if you're taking that with you, it's going to cross-contaminate whatever area you're going to. I mean, even though it may not look soiled and contaminated right away, again, it's growing, it's proliferating, and then later on you'll have something that is totally contaminated and can cause respiratory issues or central nervous system issues if it's full of mold, and mold spores are everywhere. I mean, we're breathing them right now at safe levels, but when it has a substrate or a source to grow, that's what happens. And one other thing, you talked about ants. Ants have, you know, fire ants have multiple types of stingers that they don't lose like bees when they can sting you once and they die. But ants will sting you over and over and over again. So the best way to treat that is a cold compress, wash the area with soap and water, use some alcohol to definitely disinfect the area. It's going to burn, it's going to sting, but you should be okay.
Okay, so there's going to be a lot of debris out there for a while.
Yes.
You know, the mayor's going to try to get it up as quickly as possible, but it could take some time. Now, the risk of stepping on a rusty nail, I mean, should people take precautions by going to get vaccinated? Or,
you know, if they can possibly, if they've stepped on a nail, if they've cut themselves, they should see if they could get a tetanus shot. However, I also advise people to get like a little go kit or a safety kit. A lot of us are back on the roads. I've seen a lot of aggressive driving, people trying to get to different places. It's good to have something with you at all times if you're going to help, you know, to that, you know, minor first aid you definitely need, because sharps is like the third biggest hazard in the water.
But let me ask, can you get a tetanus shot as a preventative, you know, before the fact?
Yeah, is it worth doing that?
It's possible. medical, you know, so ask your physician. I always tell people that, because everybody has their own medical, you know, care needs, and so some people may be able to do that, whereas others cannot.
And you've got some
tell us about the supply list.
Okay, so you know, here, this, if you can get this is a rescue mask pack. So if you're having to give CPR to someone, it actually protects you and it protects the person that you're giving CPR to from transferring any, you know, contaminants and fluids. So you know, you put this over the person who you're rescuing, and you would actually do the mouth to mouth through here. So it's very safe. Keep these alcohol swabs with you. Anti-itch cream or spray, something that people don't think of. You really want to have this on hand for the stings and the bites. If you get those cold compresses, the kind that you break apart that get cold, have those with you. Definitely have gloves, because when you're dealing with people, you don't want to get contaminated, and you don't want to contaminate them in case you have dirty hands.
And when you're going back into your house, like someone just told me, go back and get some gloves as well. Don't touch your stuff with bare hands. That's a good thing to have on hand.
Right, for metal objects as well, because you're thinking you can clean those off later. Yeah, and you probably can with the metal objects, but again, touch them with the gloves, bag them, tie them very tightly, and when you're bringing them to where you are now, you know, staying, try not to bring them indoors, because that can ruin your indoor air quality as well. The mosquitoes, that's a really big issue as well now, because we've got a lot of standing water, and so if you're in an area that's rural or remote, or just has a lot of standing water, get the stuff with DEET. This is the time where I say, you know, pull out what I call the big guns.
Because what are the mosquitoes going to be like in a few days?
Oh, they're going to be, you know, they're laying eggs right now as we speak. They don't take long to hatch, and they will be absolutely everywhere. We've got a lot of mosquito-borne diseases. Mosquitoes are the #1 killer in the world, okay? Mosquito-borne diseases. I also have, you know, natural for the kids, because kids should not have too much DEET. However, again, if your kids are in that area, parents, I would just spray this on your hand and then apply this to your kids. Don't spray this around your kids. That is the worst for the respiratory system as well. So
I want to remind everybody, we are taking your questions. There's the number right there on your screen. 833-243-5789.
Perfect, perfect.
Right, I had another question.
Yes.
You know, a lot of people had severe damage to their homes, major damage to their homes. Some people had minor damage. I'm talking about people whose homes never took in any water leaks, but because there was so much wind and rain for a prolonged period of time, they had some minor leaks and maybe some stains in their ceiling and stuff like that. Do you need to go into the attic? I mean, what's the mold concern for minor moisture? And
1 to 2 inches of water, maybe.
So minor moisture becomes major moisture later on down the line, because sheetrock is all over our homes. Sheetrock is like the perfect, you know, substrate or, you know, place for, you know, mold to grow. It's like candy to mold.
It's an incubator.
So it is. And so even though you're thinking just a small, you know, little stain now, you definitely want to bring in a professional to go up there and look for any types of leaks. If it's a roof leak, get it repaired. If it's a plumbing leak, get it repaired. If it's your HVAC system, get it repaired. Yeah, another thing with HVAC systems in homes that have standing water with them. Once you start to run the air conditioner again, you know, you've got a lot of contaminated air, and our HVAC system ductwork is lined with fibrous or fabric type material. That can also pull in that mold, and it, you know, we've got these really moist air, and it grows in there. So consider, you know, replacing that ductwork as well. It's worth it.
That's a good point. Yeah, you're right, because once you get that going again and you get back in the house, it's just spreading.
It is, and cleaning ductwork, that's not going to help it.
Wow.
So, yeah.
Thank you so much. Is there anything we should know going forward in the next few days, especially because people are really thinking about safety, food, shelter, getting their kids back to school, but our health is of utmost importance. Is there anything parents should keep in mind?
You know, parents, I know you want your kids to be able to play outside, and, you know, they're going stir crazy. My daughter is as well. Make sure, again, that you're protecting them, their skin from the bugs, but you're also protecting them and having them wear maybe longer clothing. I know it's hot, but don't expose their skin to the air, and make sure that their shoes are covered. I see a lot of kids and parents out there with bare feet. I see a lot of kids and parents out there with flip-flops and sandals. That's really not good enough, because you can, you know, like you said earlier, walk and just step on a nail, or there's debris.
That's my fear right
There's debris everywhere.
I love my flip-flops.
I love my flip-flops
But I put them away for a while.
Yeah, it's smart to keep it covered toe shoes only.
Keep it covered. Same thing for the adults that are going into help. I've seen people put on those fishing waders. Best thing you could do if you're getting into the floodwaters.
Yeah.
And so if you're rescuing somebody in floodwaters, because I know that there are some neighborhoods where the water's still rising and people are still sheltering in place, if you're going through that floodwater, that's fine. You have to leave. You have to go in the floodwater. But again, once you get to a place where you can clean yourself off, wash, soap and water, disinfect ASAP.
All right, so says the Tox Doc.
Yes.
The toxicology doctor.
That's
Thank
right.
you,
Yes.
Dr. Noreen. That was very helpful information.
Thank
we really
you so
appreciate it.
much.